as mentioned, one of the major keys to reopening the country is, of course, testing for coronavirus. Experts say without it on a massive scale, it will be impossible to gauge the full scope of the outbreak and who may have protective antibodies. So where do we stand on all of that? Dr. Scott Gottlieb could have some answers. He's the former commissioner of the Food and Drug Administration under President Trump and a CNBC contributor as well. Dr. Gottlieb, good morning. It's good to have you with us.
Thanks.
Before we get to testing, the federal stay-at-home guidelines, as you know, expire in 10 days. Scale of 1 to 10, how concerned are you that some places will reopen before they're ready?
Well, some places are going to reopen. You're going to see different states make different decisions. The states that have been hard hit are probably going to be later to reopen. You'll probably see them reopen sometime in mid-May. States that haven't been that hard hit are probably going to reopen early in May. I think some states are ready to start contemplating slowly reopening their economies in the beginning of May, states that haven't been hard hit. And this is going to be a slow process. It's not going to be a light switch. They're going to reopen gradually over the course of May and June. What you're going to see come back first is recreational activity. Outdoor recreational activity is going to be allowed first. So that's likely to roll out in early May. And as your piece said, some states are already contemplating that. I think in terms of being ready, the things that we're not going to have in place is what we're going to be discussing. The testing isn't going to be in place, and also the contact tracing, the ability to do the work of tracking down everyone who's sick or who might have been in contact with people who's sick. We're not going to have all of those resources in place that we want to have.
Yeah, well, that's the question. I mean, do we have the capacity to do the testing we need to do in order to reopen the economy, which everyone so badly wants?
Well, look, we've made a lot of progress in ramping up testing in this country after having a slow start. And so we're testing probably more than 1 million people a week right now. I think a good rule of thumb would be about 1% of the population on a weekly basis. So the ability to test about 3 million people. We're not going to be there. We're not going to be there in May. We're not going to be there in June. Hopefully we'll be there by September. So the reality is, from a clinical standpoint, we're probably not going to have the optimal amount of testing, but we'll have better testing in place than we did. I think when you look at what we call the positivity rates, how many of the tests that we're conducting right now are actually coming back positive, it's running nationally on the order of 20%. So 20% of all the tests that we're doing nationally are coming back positive. In hard-hit cities like New York, that rate is running around 40%. To give you a basis of comparison, when you look at tuberculosis screening in Bangladesh when they were trying to control outbreaks, or Zika screening when we had Zika outbreaks in Puerto Rico, the positivity rates were about 1%. And so you probably want to see positivity rates well below 5% to know that you're doing enough screening. You want to have a lot of people coming back with negative tests if you know that your screening is widespread enough to try to catch small outbreaks before they become large outbreaks.
But, Doctor, I feel like I just heard you say that we won't really have the testing capacity that we need until probably September. But at the same time, we're actively talking about reopening the economy in many of these states. So why isn't that dangerous to reopen without having that sufficient testing?
It's a risk. There's no question it's a risk. I mean, we won't have the testing that we want until September, I think, in terms of the kind of broad coverage. You're still going to see high positivity rates heading into May. So, look, there's risk here. There's no question about it. We're not going to have all of the tools and all of the screening that we want in place. We're also not going to have all the public health workers to do the contact tracing. That's going to be another limitation. Now, the states have been bringing on personnel to do that. The states are working aggressively to get more screening in place, more testing capacity in place, but it's not going to be in place. If we wait until we have sort of the optimal framework for testing, we'll be waiting until the fall, and that's just not going to be possible from an economic, social, or public health standpoint, because there are public health costs to keeping things shut down. People aren't seeking routine care. Vaccination rates are down. So this is a risk. I mean, the hope is that the summer is going to be somewhat of a backstop against spread of this virus. So as we enter into the summer, hopefully we catch a break with that. We don't know that that's going to be the case. And so we're going to have to take this very slow. I think as businesses start to bring workers back, they should be very careful about doing this gradually and trying to monitor very carefully to make sure there's no upsurge in cases. And since we don't have all this screening that we want in place, and we don't have very sensitive measures out there to detect an upsurge in cases, we probably have to take it slower than we otherwise might have if we had broader testing in place.
All right, Dr. Gottlieb, I mean, it's really disturbing and concerning, but I know that everybody's working hard to try to get this going and being done right. We appreciate your thoughts this morning. Thank you.
Thanks a lot.